Good evening, everyone, and welcome to the October 20th, 2021 Health and Human Services Board meeting. I'll call the meeting to order. Roll call, please.
Kathy Leaf. Present. Kara Koch. Dave Osnes. Present. Scotty Yard.
Present.
Greg Telejohn.
Present.
Paulette Anderson.
Present.
Deb Lindeman.
Present.
Natasha Ward.
Present.
Paul McGinnis.
Present.
And we have a quorum. Move on to approval of the minutes from September 15th. Everyone's had a chance to look at those. Are there any additions or corrections? Hearing none, those will stand as written, and we'll move into public comment. The remaining folks, we're going to give you 2 minutes for your comments. John.
My name is John Strom. I live in the town of Forest, St. Croix County, Wisconsin. Our issue is large wind turbines and health issues. For those who have not heard, I am not an anti-wind activist. I spent several years of my spare time researching wind turbines in order to build my own wind turbines. So I know more about wind turbines than the average person. Wind turbines come in many different sizes. The health issue only appears at the industrial size with turbines above 1.6 megawatts. The physics of a 200-foot long blade, 12 feet wide at the base, blocking the wind for a moment, converting wind to mechanical motion, and creating an acoustic pressure pulse is inescapable. The town of Forest has about 18 people per square mile, and a proposed distance of only 1,250 feet from turbine to non-participating residents. With 52 turbine sites, the impact will be enormous. Thank you.
Thank you, John. And Peter.
Now everybody can hear me. Last night I spoke with a man who tested positive for COVID in August. He has a family member who's immune compromised, and he has reasons to fear the virus. We talked on the phone. We talked to the phone calls he received from the county, and after he and his family tested positive. I asked him, did the county have recommendations for you on vitamins D, vitamin C, or others? He said no. My question to the board, why isn't that part of the calling during the contact tracing? Where do we stand on getting our county good health information? The NIH website has medications that are both safe and reliable and readily available. Have you ever been to it? These include meds which are approved and currently under study for the treatment of COVID. How great would it be to have a county encourage these meds to not only those who are testing positive and those at risk, but everyone regardless of their vaccination status? Why do we even talk about COVID if we're not doing these basic things? Thank you.
Thank you, Peter. Anyone else wishing to speak or make public comment? And last time, anyone wishing to speak or make a public comment? Seeing none, we'll move on to our business items. We'll start out with the COVID update. Kelly and Ellie, welcome.
Thank you. I'm going to go ahead and share my screen. Thank you for having us this evening. My name is Ellie Clausen. I'm the epidemiologist for St. Croix County, here to present on COVID-19 data. I will then hand the presentation over to Kelly to to discuss our health advisory, testing, and vaccination. So briefly, where are we in terms of COVID-19 disease in St. Croix County? As you follow, you can see the entire green line on the graph. That green line on the graph is the 7-day average of daily positive cases. What that means is we do take that 7-day average of how many cases, positive cases we get a day, and we get an average. That's always kind of what we report, as it's the most stable measure for understanding the burden of disease in our county. Right now, we're currently experiencing roughly 41 cases a day in the county. We are still within our wave, as they're called, from September. We have started to trend downward, as you can see on the far right-hand corner of that map, but we continue to have fluctuations up and down. Now, to bring your attention to above the graph, you can see from July 2021 to October, looking at the total number of positive cases that St. Croix County had that were reported to public health from laboratory results. So you can see that steep increase from July, August to September into over 1,200 cases in September. We currently stand in October, from October 1st through October 19th, 2021, at 782 cases. Now, if we continue our projection, we are looking at seeing approximately 1,200 cases in October. So not that far off from September. We will continue to track this, and this graph is available on our dashboard to follow our progress. Now, this is another demonstration of the trend of COVID-19 cases, but this now looks at the age groups and who is carrying the burden of disease, which ages are most affected. Across the bottom, you'll see the age groups by color. Our youngest age groups in yellow are the 0 to 8-year-olds. In orange are the 9 to 17-year-olds. What you can see from the graph, looking at the yellow and the orange being our adolescent, that pediatric population, is that as we move from January of 2021 to present day October and through September, we can see that the number of cases since we have started school in September has greatly increased in the pediatric population. In September, they actually had, obviously by that large orange bar there in the month of September, they had the greatest number of cases. Now in October, we're seeing a bit of a transition in the trend. We're seeing the cases being spread within that pediatric population, that 0 to 17-year-old population, as well in the blue. The blue bars represent, if you see from the bottom row there, 36 to 44-year-olds and 45 to 53-year-olds. This is a proportion of our parent age group. And so now we're seeing COVID cases being a mixture of the pediatric population, the school-aged kids, and then the households. And so the greatest transmission right now in St. Croix County is happening within the household and within the school-aged population. Within the schools, we've just identified there is a great amount of transmission happening. Here's a quantifiable number for how much transmission has happened. So far, since the start of the school year, 710 K through 12 students and staff, which are the minority, there are a great number of students in comparison to staff in the actual school population, have missed at least one day of school due to testing positive for COVID-19. This doesn't include their household members who have to stay home because someone has tested positive, and it doesn't include anyone else who has quarantined due to a close contact. In these numbers, we look at the first week of school, we had 85 cases. As we moved into the school year, at kind of 3 weeks later, we had 340 1 cases. In the past month, now that we are presenting here, accumulating as of 10/19, we have 710 cases, meaning that the number of positive cases has doubled in the past month within the school system. One result of transmission we do know is COVID-19 hospitalization and death. When I was last here last month, I presented on our COVID-19 hospitalizations. I'm now going to present on the COVID-19 deaths and the change in the trend that we are seeing here in St. Croix County. 10 St. Croix County residents have died in September and October of 2021 due to COVID-19. 1 was in their 40s, 1 individual in their 50s, 6 individuals in their 60s, 1 individual in their 70s, and 1 individual in their 80s. On the left-hand side, you see a pie graph that represents the age distribution of the deaths in St. Croix County, of St. Croix County residents in September and October of 2021, last month and this month. What you notice is that the green section there is very heavy, 60 to 69-year-olds. So, and that was the greatest number of deaths. Of those 6, we now know that there's 1 individual death in the 40s, 50s, 70s, and 80s. But if we look at the age distribution of COVID-19 deaths of St. Croix County residents prior, so the first death occurring in June of 2020 to COVID-19, all the way to August of 2021, the great proportions of deaths were in those in a much older age group. So we have 22 individuals in the 90 plus, 22 in their 80s, and 21 in their 70s, accounting for 75% of the deaths from June to August of 2021 due to COVID-19. So that is a very different pattern we are seeing. We are seeing a much younger age group, predominantly being those who are passing from COVID-19. No longer are we seeing the individuals in the residential homes being the unfortunate victims of COVID-19. So this is a trend that has been swayed predominantly by vaccination. And because we do know that vaccines prevent against hospitalization and death. So what we're looking here is in September 2020 in Wisconsin, this data is available at the DHS website. We're looking at the number of cases, the number of hospitalizations, and the number of deaths between fully vaccinated individuals and not fully vaccinated individuals. Now, these are rates per 100,000 individuals. So this isn't everyone, but this is just per 100,000 people. What they have found is that in the month of September in Wisconsin, the rates of disease, hospitalization, and deaths were vastly and significantly different between fully vaccinated individuals and not fully vaccinated individuals. In terms of vaccine, which is the end point of in terms of hospitalization and death, which are the endpoints of vaccination, we had 13.8 hospitalizations in the fully vaccinated individuals due to COVID-19. Conversely, we had 122 hospitalizations due to COVID-19 in not fully vaccinated individuals in Wisconsin in September. Again, per 100,000. In deaths, it was 1.3 deaths in the fully vaccinated individuals compared to 24.5 deaths in the unvaccinated individuals. So you can see by the sheer numbers in front of you the impact that vaccination has on hospitalization, deaths, and even cases. You can see the number of cases there being a little over 500 in comparison to 2,350. Okay, moving on. So where are we here in St. Croix County in terms of vaccination? In our total population, we have crossed over 54%. We are currently at 51% the vaccination. Our 16 to 17-year-olds and our 18 to 24-year-olds have surpassed in vaccination to our 25 to 34-year-olds. They're actually falling behind in terms of population vaccinated. So as Kelly will be discussing the transition to other vaccinations. So I will leave you with where we are currently, as I've talked about the number of cases in our county. As you can see from the map of Wisconsin there on the right, the entire state is in high transmission level. What that means is that we do recommend fully vaccinated individuals do mask in public indoor spaces. As we saw from the slide before, there is potential for COVID-19 illness in individuals who are fully vaccinated. And those obviously above, not fully vaccinated, immunocompromised within the school system and healthcare settings, there is masking universally recommended at the high community transmission. All right, I will now pass it on to Kelly.
Thanks, Ellie. Don't know what we did without you before explaining data, how you do it so well. So with the data Ellie presented, we have continued our advisory in St. Croix County related to masking and other mitigating measures to keep, severe disease, illness, and death as low as possible as we can. So you can find our health advisory here on the St. Croix County website. We will evaluate that again in early December and adjust as needed at that time. So the couple of the things that I'm going to really talk today is the testing and kind of where we are at as public health and healthcare and the whole response of the pandemic, as well as vaccine. I think it's really, really important to note testing, when to test. I'm going to talk a little bit about the types of tests as well, but we are early on in the response when we were getting positive cases, people maybe delayed testing a little bit because we heard over and over again, oh, I just thought it was allergies. Really this fall when working with the schools, we meet weekly with the school nurses as well as separately with school superintendents. They're obviously seeing a lot of cases, which Ellie's data showed, really encouraging any slightest symptom to test for COVID. So just outlined, I believe I used the same slide last month, but just re-encouraging how important testing is. We did start our wing testing in St. Croix County today. We had 29 people. It was interesting looking back at that data. There was one point last fall where we ran out of tests and had 500 people tested at one of those Wisconsin National Guard sites. So 29 today. That site will continue through December 8th. I don't have a slide on this, but I know it's on our website. It will alternate sites. Next week, the wing will be at the St. Croix County Highway Shop in Deer Park, and then back the following week at the Baldwin Highway Shop. The hours on that are from 12 p.m. to 4 p.m. every Wednesday till December 6th or 8th. Okay, next slide, Ellie. So a little bit more about testing. Testing has become quite confusing. I will be the first to say to staff, man, I can't keep all these different tests straight. And now with many different tests on the market that are available in an at-home setting, it's kind of important that we kind of talk a little bit about the different testing. Molecular testing really is the best. These are known as diagnostic testing. Sometimes people may say lab testing, which is kind of a misnomer, but NATT testing or viral testing. If you look at our St. Croix County dashboard, the majority of the tests that St. Croix County residents have received have been molecular testing. Antigens are a rapid test, which offer a quick result, but not as completely reliable when used in people who are asymptomatic. So that kind of sometimes has been an issue with testing. Antibody testing, and I definitely am not a doctor and don't want to claim that I know all there is to know about testing, but we haven't seen a ton of useful information related to results of antibody tests. The only thing we really know with antibody tests is it can report a past infection. But as far as immunity and that goes, it doesn't tell us a whole lot. So next slide. This slide even gets busier. I hope we can get these graphics on our website, because I think they really break down the specific kind of tests. And I'm not going to walk through this one for you, but this really talks about, kind of lays out the different molecular testing, antigen, antibody, and at home. There are many differences. We often get questions, well, I got a swab in the nose. What kind of test did I have? And I always my answer to that is, well, it depends, because I really don't know if someone got swabbed in the nose, whether they had a rapid antigen test or a molecular test. So we'll get this on, because testing will continue to be important as we work through the response, as we continue to see cases. Next slide. We do get a fair amount of questions about, well, how did you get my number? Sometimes people are a little bit surprised that public health is calling them to follow up with their positive result. I can assure you that we do this because of COVID-19 is a Category 1 disease. You probably heard me say that many times throughout this response. Category 1 diseases mean they have reporting requirements, or it has a reporting requirement. And the positive test itself is reported to us by usually labs and clinics who are running the testing. I think it's also important to note, public health we are not doing tests at public health. We work with our providers to figure out what their capacity and needs are related to testing, but public health by nature, we aren't doing testing. So I wanted to make that clear. As far as the reporting results, this is kind of a slide that walks through how the tests get reported to public health. And you've heard me talk about the Wisconsin Electronic Disease Surveillance System. That is the reporting system where the clinics and labs report one's positive test, and it comes into our side of WEDS, which we see, and that is how we assign out these cases. I know I've talked in the response about divvying up the workload, and I don't know if Ellie mentioned, but before 10 o'clock today, we had 57 positive cases. So that means 57 reports were in our WEDS system that we divvied out to staff for them to begin their follow-up on the COVID-19 positive test. Ellie, did you want to say anything else about this slide?
No, I think
Okay.
you definitely covered it. Thanks.
Okay. A little bit about vaccines and where we're at. It is really kind of confusing here. I'll talk quickly about this slide. My next slide really talks about the process in which boosters and different vaccines, who gets when what, and who is eligible for when what. When a newer age category is approved, so to speak, related to vaccines. So this is kind of what is standing out there right now. There's a lot of activity with the FDA and the CDC about approval and meeting regarding their recommendations on boosters, as well as that Pfizer emergency use authorization for kids 5 to 11 years old. The next, and this is that authorization process we talked about. So this is the Vaccines and Related Biological Products Advisory Committee. That is separate from the Advisory Committee on Immunization Practices, but they are meeting and constantly evaluating the studies that are being done by the 3 approved Johnson & Johnson, Pfizer, and Moderna vaccines. So you can see we even have meetings going on today as we speak, October 20th. Likely we'll see a vote for boosters for Moderna and Johnson & Johnson. We have been alerted, nothing in writing, but kind of in our communities of public health that talk, we might, we are hopeful that the 5 to 11-year-olds will be available and approved by early November. But as I've kind of shared with other groups we talked to, it might be delayed. There might be more discussion among the advisory groups on that. We don't have that in writing, but it's just kind of, don't be surprised if that group takes a little bit longer to get final approval so we can start getting those vaccines. On one positive note for that, we were able to pre-order for 5 to 11-year-olds related to the Pfizer vaccine, and that survey was due today by 5 p.m., which we completed. So we have ordered vaccine for that group. The federal government wanted a pre-order of any enrolled vaccine provider, which we are one in St. Croix County. Next slide. Oh yeah, wouldn't do my due diligence if we didn't talk about flu. We anticipate there will be a flu season this year. It was very absent last year, actually almost non-existent. Important to note for anybody listening and watching, public health does not regularly track flu activity. The only reportable flu cases to the local health department are people testing positive for flu that have been hospitalized. Someday we may get there with COVID. We are not right now. Every single positive case of COVID gets reported to the health department. But that is important to note as you guys are interested or ask about flu data, that we don't have a ton of great flu data. However, we still vaccinate against flu. In St. Croix County, we do two different districts, school-based events every year. We did one of those today, and I believe the final count was 224 flu vaccines for the Baldwin-Woodville School District. And we also vaccinate, so that was our public health staff. Our public health staff also vaccinate St. Croix County employees. And those clinics will be all wrapped up before November 1st, so flu will be done. As far as vaccine, you can still get your flu shot through public health on Mondays, but our big mass clinic types will be done then. As far as COVID, we've expanded our hours in which people can get the booster doses, and that is every Monday at the Services Center from 12 to 4. And you can sign up for your booster doses or even starting a dose. It doesn't have to be necessarily a booster, starting a series, on our website, on the St. Croix County website, the vaccine page. So, yeah, that is our report for the month.
Any questions or comments for Kelly or Ellie? Dr. McGinnis.
Just one quick comment. It just came out of the news feeds that the Moderna and Johnson & Johnson booster doses were authorized by the FDA this afternoon, so it'll take a little while to make it through the CDC process, but that did go ahead. And the second comment is that the dosage for the 5 to 11-year-olds that's going to be considered is 1/3 of the adult dosage. So again, that's a much lower dosage, but seems to produce a good antibody response with, again, fairly low side effect profiles, but we'll see more data as that comes out next week.
Anyone else? Kelly, just a comment on your volunteers at the service center. They do a great job. They, as I sat there finishing up my booster, there were a number of people walking in that were really nervous. And by the time they were done, they kind of looked over and they said, these folks are pretty good. I feel pretty good right now. So please pass that on to them, that they're doing a great job. And thank both of you and the entire staff for all your great work, too. It's greatly appreciated. Good.
Dave, if I could make one more comment really quick, that is something I didn't discuss today. Our volunteers have been absolutely incredible through this process. We've really utilized them a lot in our vaccine clinics. As you can see, the cases aren't, they have spiked here in September and October. Our staff are putting in incredible amounts of work, and they have been amazing. So yes, if you see a volunteer public health staff, thank them for what they do, because 19 months in, we're feeling it too. So I will pass on your appreciation. Thank you guys for letting us present today.
And thank you both again. Thank you, and thanks the entire staff, Kelly.
Thanks. Bye-bye.
Okay, we'll move on to item number 2, monthly financials. Faye?
Good evening. So the monthly financials, this is through September of 2021. We're starting to see a lot more color in our financials. The greens are the good news, where we've received more revenue than what we had budgeted. Some of the reds are where we've gone over what we have budgeted, or we just had expenses in a place where we didn't budget for them, but they were well within a reasonable amount. Purchase services, when we compare this year to last year, overall, that is higher than it was in September of last year. When I look at the trend, it's both in all three of them, actually, behavioral health, children's services, and CCS. Behavioral health and children's services, we've talked about quite a bit. We've had a lot of additional expenses that we've been purchasing. CCS, it's because that program is just continuing to grow. We had kind of a stagnant where we weren't enrolling a lot of people because of the way services were being provided. They were limited, but that is, I think we're up to 131 recipients now. So as we're serving more clients through that program, that purchase services will grow up, and that gets fully reconciled next year to get reimbursed. Two of our big grants, children's services and behavioral health, we get basic county allocation. All of that money has been received. So our state funding you're going to see coming in smaller increments going forward through the rest of the year. That's just smaller grants where we have some expenses each month. We won't receive any big chunks of money now till reconciliation, which happens next spring then. If we go to the health center campus, as you'll look at the totals, we are continuing to lose money there. They're having residents coming in, but we're just, the number of residents we see, it's kind of staying level. We have admissions, we have discharges. I did just apply for phase 4 general relief, so that's additional money to help cover the losses that we're experiencing in the skilled nursing facility and in Orchard View. That's really all I have for you to point out, other than what you can see in here. Does anyone have questions for me about the financials? Yes.
Yeah, thank you, Faye. I do have a question on the health campus revenue. That looks like that's pretty significantly down, as you commented on, but one of the categories that's down most significantly is the other federal payment. Could you help me understand a little bit about what that is? Because that went from 380 last year at this time, 380,000 last year at this time, down to about 20,000 this year.
So I believe that's our supplemental payment, and it just has not posted yet. So
Okay.
that's I think we get it in 2 separate chunks, and the big chunk of that has not come in yet.
Okay, so you're expecting that to come in?
Yep.
Okay, thank you.
Anyone else have a question or comment? Thank you again. You're keeping us in good shape, young lady. Keep up the good work.
Thank you.
You bet. We'll move on to item number 3, which is board orientation. One of the things that Bob and I have been talking about for a while since he got here was trying to bring some folks in from either the health department or human services department and explain to the board what the different things are going on and what services we do provide our county residents. And Bob has heard me say it many a time, we're not only educating the folks that are in this room here, but we're giving out some good information to the general public as well, and I think it's very important that we continue to do that. So this week, or month I should say, we're going to talk about the administration office support team, the folks that we meet as soon as we come in the front door up at HHS. Colleen, you want to get us started on that?
Sure. So I did do a little bit of a PowerPoint here, and I have a few things.
As most of you already know me, I am Colleen Linder. I'm the Executive Administrative Assistant to the Health and Human Services Director. So I do my best to support Mr. Rarette in the day-to-day needs at Health and Human Services, and then I also supervise the office support team. As you can see, we drafted our own mission statement there, and we take pride in striving to meet that mission each and every day, so to interface with consumers and staff in a positive, courteous, and timely manner while assisting and or directing them to resources to help meet their needs. So we have a lot of information available at the front. The team has much focus on the consumer needs, but I do want to highlight that we consider the staff our consumer as well. We want to support them as one of our customers and hope to help them to do their jobs more efficiently and effectively. So we do support them as well. So I'm often asked, what is a typical day like at Health and Human Services? In fact, I've been doing interviews today, and it was posed to me twice today. So what is a typical day? Well, as you can see, there's no typical day. It's all based on who comes in the front door, who is on the other end of the phone, what staff has an emergency, what needs to get out the door, what's coming in the door, and so it's very unpredictable. And the other thing that really weighs in on that is that our consumers or our customer range in age from birth all the way till death. So it could be somebody that just had a newborn all the way to somebody saying, you know, I'm really struggling with my parent with dementia, and then everything in between. We're also working through with many consumers that are either struggling with some substance use or mental health crisis, to food insecurity, and so they each pose a different response or need. As you can imagine, then the onset of COVID-19, really we were inundated with every call that you can imagine and questions all over the board, so that's what they were dealing with. And we often get calls that aren't even related to what we do in our building, so then we spend time in kind of informing, this is where you can get that, but we can do this here. And so it is all over the board, and so the typical day is really no typical day. So the team consists of 4 staff, full-time staff, and 1.2 position. We work as a team to complete all the tasks that you can see listed there on the left. And we are cross-trained to support each other, and we do the best to be able to meet the needs at the front. They're an awesome team, and but they each do have an area of focus. So on the chart, I wanted to highlight in the yellow there, the significant drop here in the walk-ins in 2020. So that was really difficult for my staff because they're so used to being there and helping people, and we sent them home for a while. I was there most days, and then we started having one person come in each day, again trying to avoid the spreading of COVID. But there was this significant drop because services changed. How we did services in each of the programs changed so significantly and so quickly. So there's that big drop. But then coinciding with that, you see the increase in phone calls. The red phone calls in 2020, the phones were really ringing off the hook. And again, a little bit of the panic with COVID and where can I get help and how do I handle this and what do I do with my kids and how do I get a job, and I just lost my job and I don't have any food. And so it was this quick response of we weren't seeing people come in the door, but we were still trying to reach them and help them as best we could. And I will say that the program staff just did this amazing job of shifting gears and then informing us, okay, this is what we did to shift gears. This is how it's going to look different at the front or at the phone calls, or and I'll show in the next slide, like even with the mail. Then the walk-ins, and I just want to point out that we are seeing them to start to come back, which is a good thing. But the phone calls still continue to be significantly high. So window one is Amy Lessman. She's been with us for a few years now. She gets the main phone call line, so our 6991 phone calls. She is the first person you likely see when you walk in the front door. She assists consumers redirecting as needed or giving resources. The mail, the deliveries, everything is often right there. So she processes our mail and goes through each piece of mail, determines who gets it, date stamps it, processes the, and receipts the checks that come in. But she's also cross-trained to provide support to economic support and youth justice, and then works real hard at just helping staff however they may need. And again, that's based on the day, from can you reserve a room for me, can you find a car for me, can you make 44 copies of this and I need it in 20 minutes, to, you know, it's just kind of all over the board. I point out this outgoing mail, this is the mail that's just going out, so not stuff that comes in that she handles every day that comes in a big bucket that gets, you know, dispersed to everyone. But the thing that we did see a big increase in the end of 2020, which isn't on here, but also still continuing in 2021, is the mail that's going out, because it's become a real good way to communicate and connect with consumers. So paperwork that we need signed and we need it to come back is going out. We were using business reply mail, so they get a pre-postaged envelope in the packet, so we're a little more guaranteed that it's going to come back. So that was really a big change. It's pretty much, it's leveled out a little bit now because they are seeing a few more people, but that was a big shift for us in reaching clients. So window two is currently vacant. It was a resignation by a person that had been with the ADRC for quite some years, and that's who I was interviewing for today. This person is also cross-trained to do many of the clerical tasks, and then is the person that's like the backup to window one. So phone calls come in, if there's already on the line, it rolls to the next window. But this focus is for the ADRC reception. Per state contract, we're designated to have a separate receptionist for the ADRC as well as a waiting room. So, and then she focuses on assisting the ADRC staff with any clerical type tasks that they would have. I skip window three, which I was pointed out by Dave. And the only reason I do that is that I do not supervise the staff that's at window three. She is a great part of the team at the front, but she is actually supervised by one of Faye's staff. She's a finance person, so she's doing more of the checking in clients, if they need to pay a bill, if they come in and pay for something else, and then does tasks regarding accounts payable or accounts receivable. Though we do really appreciate having her up there because she is an asset for us as well. There also is a window 5 that I don't mention in here. Window 5 is public health, so it's all the way around the corner. But it is a more private area where people can come in, and if they have a question regarding any type of public or any type of health issues or concerns, they're in a more private area instead of right out in the front in the reception area. So there is most often someone manning window 5 as well. So then window 4 is our economic support focus window, as well as works with the Birth to 3 staff. This is recently filled by Joe Alm. She's being cross-trained on all the basic clerical duties and then learning the focus of economic support in Birth to 3. So she's learning about all the consortium work. She is able to provide the emergency food share cards. So if the consortium determines that they meet the need and it becomes eligible where she can see it in the database, then they are told they can come into the services center and a card is activated for them there. So that's something that we did see quite a bit of increase in for a while. That has leveled off a little bit as well. But then they can also turn in paperwork they need to get any of the benefits that they're trying to qualify for. And then she's the one that would scan it in and make sure it gets to the proper case for the consortium. Again, economic support is required to have a reception person available, someone in the building to assist people. We also have computers and phones in our front lobby that are for consumers to use that may not have their own technology, and they are able to connect with the consortium. And like healthcare.gov and the county website is out there, so they can use it to get information. And then we have one support person that sits more back in the flex area, which we call like our clerical pool area. And she's like the main support for behavioral health, children's services, and CCS. Her name is Claudia Earl. But she's also our main backup to the front, so somebody's on PTO, she can step up and help at the front. If we're short-staffed, she can cover lunches or breaks as needed. But she also is our Spanish interpreter and translator, a huge asset to us, and to HHS. She also was an asset during COVID because there was many things that they were trying to reach the Spanish-speaking community regarding testing and vaccinations and all that. And so she did even do a little bit of it beyond the HHS divisions. So she also is one of our design people. She's real good at making brochures and flyers and can stay within the branding standards. And so she likes to do that. But yeah, so that's us in a nutshell. The COVID presented a lot of changes in how we met consumers' needs and staff needs. They continue to adjust every day to the ever-changing expectations, and I truly appreciate what they do, and we'd love to have you stop in anytime and check out our front area. So that's all I have. Anybody have any questions?
Questions or comments? And Colleen, if I remember correctly, for a while, some of the folks were helping out with public health as well, weren't they not, with some of the things that they
Yes,
were doing?
and that does continue to a degree. So during the height of COVID in the spring, so there was, a couple of my staff likely working at home each day, and if they were at home, they were likely doing public health work remotely, but then they would come in the office and then they would focus on the clerical stuff that we were still trying to keep up with. The thing that was interesting, the mail still comes and deliveries still come and the phone still rings and all of that, even though we're in this pandemic and people are in a panic. It proved to be very interesting, and we had to be very creative on how we're going to receive deliveries, how are we going to get the mail in the door, because we were trying to not, mingle with other people. And so it was, became very creative and very a lot of running across the building for a few weeks until we got things ironed out. But yeah, they continue to try and support public health as they can. So they learned a lot of new things very quickly regarding that. So yeah.
And again, we are very fortunate. There's another small group of our county employees that go way up and above, and we are very appreciative for all their great work. They do a super job, and please pass on our thanks to those.
I will do that. They are great.
Paulette.
And thanks. And I've been there many times, and I've been on this board for many years, and I toured it with the group that toured all the facilities, and I even saw more and learned more, and I think next year the HH board should tour that facility while it's in operation, because it is amazing. So thanks for all you do.
Yeah, it's a busy place, and each time I interview somebody and they come in and they're just like, this is really all underneath this roof. It's like, yep, it really is. And so yeah, so that's one of the things that my staff really try to do is inform people. So even if it isn't something that maybe we can assist them with, then maybe here's someone else who can, so we have veteran services under the roof, so they may call in for one thing and end up getting help with another, which is just a great thing all the way around for the programs, because they're also interconnected. Somebody that's receiving services in children's services might have reason that they need some mental health care or some substance use care. And so you really learn how they're all really intermingled, and yeah, so thanks.
Anyone else? Okay, thank you again. Move on to our last agenda item, which is our director's report. Bob?
Thank you, Mr. Chair. I'd like to just chime in too and reiterate that our support staff, Colleen and her staff, are the face of our department. So when people come to our facility who maybe have never been there before, that they're the first people that those people that need our help see. And the amazing amount of complexity and skill that has to go into this kind of position is, to me, it's mind-boggling. And when I started working here about a year ago, a little over a year ago, there was relatively few people in the building, and I didn't know my way around. And thank God Colleen was there to point me in the right direction and help me get connected to the people I needed to. But I can't say enough good things about them, and I appreciate that Colleen was able to put this presentation together and show you a little bit of what they do. So thank you for that. Thank you, Colleen. All right. For my director's report, I tried to hit on some of the priority areas that we're focused on right now. So this isn't a comprehensive report of everything that we're doing, obviously, but there are some things that I felt it would be good for you to get an update on, so that's what I'll focus on here. If there are questions for other kinds of topics or areas, I'm happy to try and answer those too. But I thought I would start with an update on the American Rescue Plan Act funding that we received. Most of that funding will be spent in 2022, but there is some funding available for specific projects this year still. But to start off with, there's four main initiatives. I shouldn't say main. There are four initiatives that are rather high dollar and require recruiting workers for, that I wanted to focus on here. The ones mentioned: Crisis Emergency and Stabilization Service Case Manager, the long titles, but this primarily would involve workers that go out in the community and provide on-site support for mental health and addiction kinds of needs. Early intervention specialist, which would be primarily, again, involved with pre-treatment early intervention services with pretrial and persons involved in the criminal justice system. A community case manager, I might have mixed these up a little bit, but the community case manager RFP was for 2 FTEs. Community case manager and peer recovery support specialists, which are persons with lived experience who work with persons with mental health or addiction needs in the community. And some of these positions are fluid. They're able to be moved to where the needs are and not necessarily assigned to a specific community program or service area. The idea here is to look at early intervention opportunities in the community where we don't have current funding or don't currently have personnel to go there and provide these kinds of services. The intention behind all of these initiatives through ARPA are to prevent hospitalizations, to prevent rearrests, to prevent persons from falling into a crisis situation, so that we have a better opportunity to affect their situation in a positive way and prevent high cost and oftentimes poor outcomes that result from placements in institutions or residential placements that are resulting from crisis. So we put out 4 RFPs on October 13th for requesting proposals for all 4 of these particular initiatives. And there's a 2-week period of posting those RFPs, and then when we get the proposals, we'll score them, talk with applicants or those that have provided proposals, and eventually select a vendor for each of these initiatives. That would be next week, I think, when the proposals are due. Withdrawal management, there's a concept paper that I did draft, as I said I would, but I finally did draft that, and it's right now it's in review with DHS. I'd like their input before I show it to you so that I can make adjustments to it, or to make sure, first of all, that it's viable. And then I will present that to you as a concept paper. The idea here would be to provide withdrawal management services at a lower than hospital level of care for the community, for potentially for law enforcement to drop someone off who they've encountered who might be have acute intoxication and or withdrawal kinds of needs. So this would be not a hospital level of care. It would be a community-based service with professional support and professional oversight of the person's care needs. If someone needed a higher level of care, they would be referred to a hospital or wherever they needed to go. So that's coming as soon as I get feedback on that concept paper. I'll share the specifics with you. Recovery housing, all we have to do with that is, I think we just finalized the reporting requirements for the vendor, and then we can present that contract to them. This is assistance with rental assistance for people who have primarily have addiction disorders and or mental health concerns that require some sort of supportive housing in order to stabilize and find permanent housing and employment, that sort of thing. This money would be used to support them in their first month's rent, to help supplement the cost of that. And the provider, the vendor that we're looking at is Onyx, who provides recovery housing and is expanding currently in their recovery housing efforts. So our intention here is to help with rental support, rental assistance, and then provide support through our other professional services in those 4 RFPs that can also provide care with on-site with the recovery housing residents. Some of that money can be spent this year, I believe. I think there's $10,000 allocated for this year, so we can get that going as soon as we get that contract signed. And we're trying to do that as quickly as we can. The electronic health record, the funding through ARPA for our electronic health records was one to look at a potential replacement for the electronic record that's used in public health, and the other opportunity to use this money was with updating our electronic record for behavioral health. We decided to go with a different vendor for public health, and I signed agreements last week or the week before with that vendor. Champ Software is the name of the vendor. And we've had a couple of demonstrations from them to review their electronic health record. One was sort of a general overview, and the second one was specific to the finance module. But everyone seemed in agreement that this was a better electronic health record in terms of functionality and in terms of cost. So we switched from NetSmart to this vendor, sent a letter to NetSmart earlier this month, a non-renewal notice. So we'll be switching to that as of January 1st of 2022. Another note here is that Great Rivers Consortium that Economic Support is a member of received some additional ARPA funding. The consortium receives an amount, and then a specific amount's allocated to each county. And our amount that we can look at utilizing is, I think, $34,000. Is that right, Faye? And with that $34,000, we're looking at how we can use it towards technology improvements for the economic support team. And Rhonda and Faye are both looking at eligible options for how to spend that money to advance or to improve our technology capabilities within economic support. And then the other ARPA-related item is the bonuses for healthcare campus staff that the board approved to be spent before the end of this year. So we're working with HR and finance on how to, and of course Sandy, on how to roll that out prior to the end of this year. Let me see if I forgot anything. I think those were the main points, but I'll stop here for a second. Oh, one other thing that I jotted down because it's a last minute sort of addition. the state of Wisconsin, in the state budget, there was $10 million approved for emergency services, but there wasn't any real definition as to how the state should spend that with respect to emergency services. So a small group of human service directors from the Western region met with Sarah Dietrich, yes, Castor, from the WCA, to generate some ideas for how we could help the state spend that money in an intelligent way. And what we looked at was, I think, primarily was how to develop community-based early intervention and crisis services based on community needs, based on systems developed within communities, essentially things that align with what we're trying to do with ARPA funding. So if we could get a portion of that funding to help sustain and or further develop some of our ARPA initiatives, that would be the goal, I think, of pursuing this funding. Now, it's in the fall session here. I know there were some committees meeting on how to utilize this money, so I don't know where it stands at this point, but from my standpoint, my input was with $10 million, I think we're better off doing something like that that's community-based and systems-based rather than trying to fund additional beds, brick and mortar kinds of solutions. If we only build more beds, all we're doing is reacting to a situation that continually gets worse, and I'd rather be at the front end of that, upstream of that, trying to do things that prevent those placement needs in the first place. I understand there's a need for both, but the focus of, I think, where we could be effective is in the front end of that continuum of need. So I'll stop there, I promise, and then I'll see if you have any questions about any of this. Okay, and I'll just keep the board updated as we move through this stuff. The next thing I had was Aging and Disabilities Resource Center, the ADRC, and the first item I listed there, I think, as you know, Brad Beckman has decided he's going to retire, and he's going to be with us until December of this year, so we only have him for about a month and a half here. And I know he presented Dave with Chair Osnes with a statement that I believe, Chair, that you would like to read. I would just want to say quickly that I've had the pleasure of only working with Brad for a year now, a little over a year. But it was, it's obvious the impact that he's had on the community and on the ADRC, and he will be sadly missed. And I'll let Chair Osnes read the statement that Brad prepared.
Thank you, Bob. Kathy was at our ADRC meeting, and it was a little emotional, I think, for everybody. Brad started out, and I think he probably got into his first sentence, and let's just say he was choked up a little bit, to put it simply. You know, he had been here since 2008, and I stepped in and I made the comment, and I said I was very fortunate. That was the first time I was ever elected to the county board chair. And he was one of the first county folks that opened the door and shook my hand right away and said, "You're welcome anytime." And so with that, Kathy also has a copy of this, but it says, "Moments such as this are difficult to find the right words to describe a bittersweet moment in life called retirement. As I turn 65 in November, I will embrace new chapters of my life. After 14 years of being your administrator, I feel confident that I have left the ADRC of St. Croix County in a sense of accomplishment and respect. Leadership as your administrator can sometimes result in unpopular votes when times are tough and decisions are made. However, I feel that the journey together has prevailed, and it is measured in our successes. We had many challenges, but in my heart, I feel the outstanding staff the ADRC worked with a profound sense of mission and passion to maintain strong ethical standards as they provided care and service to our older adults and people with disabilities. I respected your guidance and your willingness to listen when issues and challenges were presented to themselves. In the end, those challenges were confronted, and with your perseverance and advocacy for people we support, I appreciate your hard work, dedication, and perseverance. You have created a strong foundation for the ADRC, and I know you will continue to work with that same sense of passion and commitment for many years ahead. I would also like to thank the Governing Board of Aging and Disabilities. I can't say enough about how much you have meant to me throughout all these years. You gave me a choice. You were a voice for older people with disabilities. You made a difference in their lives and in mine. Your advocacy efforts do not go unnoticed. Your caring attitude was truly a blessing. I would like to give a big shout out to Bob, Director of HHS. Bob arrived during a time as COVID was front and center, which resulted in a global pandemic. During unprecedented times, Bob never gave up and was willing to listen to me and the ADRC. Bob's transparency was and is also so refreshing. The HHS administration team transformed since I first started back in 2008, transforming from a silo mindset to a stronger team mindset. I appreciate everything you have done for building a stronger foundation with us. When I first started in June 2008, we had just merged the aging unit and long-care term, which resulted in starting the transformation of the ADRC from scratch. We hired staff members, elected board members, and developed a foundation for success. So a total stranger from Duluth Superior, who nobody knew, molded this ADRC division with the support of many. I am truly thankful and feel blessed you have had me as part of you, and you will always be part of my life. I am stronger because of this experience and chapter in my life. While on my retirement journey, effective December 10th, 2021. As I start to close my time at the ADRC, I want to assure that we have time to transition through this process together and to continue to have strong leadership. For now, I want to close this letter with a favorite quote of mine. When you should, and let go of what you can't. Love deeply and forgive quickly. Life is too short to be unhappy. And that's a letter from Brad.
Thank you, Mr. Chair. And we will miss Brad. We will be obviously posting for this position, and I'm working with HR on when that posting will come out. But again, thank you for reading that, Chair Osnes, and thank you, Brad. Also, in talking about the ADRC and some updates there, as you may know, the senior centers have been closed due to COVID outbreaks in 3 separate sites. Those all occurred in 1 week about a month ago. And because of the trend upwards in terms of disease activity in the county and those 3 separate infections, we decided it was safer for everyone to close those sites temporarily. Now, the intention here is to reopen these sites as soon as we can. I would like to see the disease activity trend downward or continue to trend downward and allow seniors a chance to get their booster shots to feel better about reopening the sites and choosing a specific date for that. We're mindful of the fact that there's a social component to this that impacts seniors, and that's critical too. So trying to balance the safety of seniors in a pandemic with the social needs of the population are both on the forefront of our minds, and we are not, our intention is not to delay reopening any longer than is practicable, but more to come, I guess, as I talk with public health advisors like Dr. McGinnis on when the timing of this makes sense to reopen. When we do reopen, likely if there's an event, we'll close that site or look potentially at closing that particular site rather than the whole system. But this was a case where we had 3 separate, like I said, infections in different locations, and it looked like this was a scary situation to the people that we serve. So, yes, sir.
And just for the board's sake, I did meet with Brad this afternoon, and we talked a little bit about this topic as well. But to let you folks know, we've added over 200 extra Meals on Wheels since the sites have been closed. And he said it's unbelievable the number of drivers that are walking in the door, being willing to volunteer to make sure those meals are getting home to everybody. So we are very fortunate and very thankful to all those drivers as well for all that great work.
Yeah, thank you, Chair Osnes, for that. They are, of course, still providing grab and go and home delivered meals, and the ADRC is still providing support services, respite care, et cetera. So those haven't stopped, but the on-site meals have temporarily been paused. Are there any other questions or concerns about that? Dr. McGinnis, did you have any comments around that? Or?
No, again, it continues to be one of those situations where you're just trying to balance out, as you mentioned, Bob, the need to keep people safe from an infection that tends to be much more serious in folks that are older, but at the same time acknowledging and balancing their social needs, which are also quite significant, and trying to figure that one out through all of this. And that's the difficult thing. I keep watching daily for those numbers to really start to come down. And I think also the booster shots can definitely help and can make a significant difference in providing additional protection for those individuals. So it's, again, that balancing act of how do you walk that tightrope. And at this point, it's tough to forecast the future as to when those numbers are going to come down. Are they going to come down quickly in the next few weeks, or is it just going to smolder along for the next few months? And we just don't know at this point.
Thank you for that. I'll move on to the healthcare campus updates. As Faye mentioned, census numbers continue to be relatively low. There is a connection, of course, between workforce and census. And when you can't hire people, you can't increase your census. So there's a symbiosis between those two things. And it's been a real challenge finding employees at the healthcare campus this past year. One thing that's a bit of a glimmer of hope here is the state has offered through it's called a Wisconsin Surge contract to cover 60%, and it's a misprint on your board packet. It says 40%. 60% of the cost associated with temporary staff through approved contracts with temp agencies. So there's the potential here to over a period of months, possibly, to hire temporary staff through contracted temp agencies to help with the workforce shortage in the nursing home. Now, we have reached out to the temp agency that the state has indicated we should work with on this, and we haven't heard back from them. It's been only a week or so. So my guess is they're being inundated with requests for workers, but they have assured the state that they do have employees that can work in these capacities. So our hope is that we can ramp up our staffing through temp agencies for now to help us then build the census based on our workforce. So that's one potential solution as we continue to try and recruit from schools and other sources for employees, and the bonus through ARPA was intended to reward those who have worked with us during this pandemic and help with retention. So hopefully we can build the workforce over time and increase the census in the nursing home so that we start to meet those census targets. But I'll pause if there's any questions related to that. Okay. And then I wanted to mention, because this was kind of a cool thing, Lisa Leahy, is that how you pronounce? Yes, Lisa Leahy, received the Wisconsin Nursing Home Social Workers Association Award for Social Worker of the Year. And this sort of flew under our radar, but Sandy brought it to my attention, thankfully, so I could acknowledge Lisa. And this is presented to the social worker who has demonstrated the best of the profession's values: innovation, leadership, integrity, service, compassion, spirit, and pride. Lisa's worked for the citizens of St. Croix County at the St. Croix Healthcare Campus for over 40 years and has touched thousands of people's lives and hearts. I think that's a really big deal, and just a real heartfelt thanks to Lisa for the work that she does and the whole staff at the healthcare campus.
Did that get in the newspapers?
I don't know, and I have to follow up and see if it was posted in.
Because
it was a recent. I'm sorry. It was a recent announcement, so I'll follow up because I think it needs to be acknowledged. Yeah. Yeah. Thanks, Paulette. Those were the highlights from my report, and I'm always open for suggestions on what you would like to know more about or get updates on. And if I don't get suggestions from you, I'll try and select those things that I think you as the HHS board would benefit from knowing more about, or at least being current on what we're doing. Thank you, Chair.
And thank you. And you seem to always have an open door, sir. I don't, it might be open only that much some days, but you always got the door open, and we do appreciate you taking the time for answering questions whenever we can, and if we can't, we come back when you're available. So I appreciate that. Thank you. Ends our business item agendas and requests for future agenda items. One thing that I will let everybody know, and we will be having a homeless issue as an ongoing agenda item every month. We'll give updates or just an open conversation with this group, but that will be on the table every month as we move forward. Anyone else? Dr. McGinnis.
Chair, does that homeless issue also include affordable housing? Because that was part of that same conversation, so I'm assuming it would be both. Would that be correct? Okay, thank you.
Anyone else right now? Greg.
I had something now. It's gone. It must be a senior.
Have we had any updates from the wind turbine committee? I don't know if the council, excuse me, the wind turbine council. I think it's been a while since we've heard if there were any meetings, or we'd been following that for a while. So I'm just wondering if we can find out if there's any updates.
I can answer that. Yes, thank you, Ken. As a future agenda item.
Good job.
Thank you, Ken.
She's the one that's like, no.
Hit your button.
Where are we at with the cemetery at the health campus?
We'll put that on the agenda too. Okay. Anyone else? Ken, you had your hand up over there for a while. Did you have something over there in the corner? Just checking. Announcements, correspondence. Bob.
I just wanted to take 1 minute to thank the HHS board for your ongoing support of our initiatives, for your ongoing support of our challenges during COVID-19. I have the opportunity on a weekly or every other week basis of talking with directors from around the state who don't enjoy that level of support. At least not all of them do. And it makes me appreciate the fact that we have a group of individuals that are focused on doing the things that are in the best interest of our residents. And that was my only announcement. I just wanted to say thank you, and it's a pleasure to work with you.
Anyone else?
Yes, Mr. Chairman, I have an announcement. This is a request coming from the Salvation Army, Grace Place. Currently, the Grace Place Permanent Supportive Housing Program and the Building a Future Housing Program are in desperate need of efficiency, 1 or 2 bedroom apartments in St. Croix, St. Croix, Polk, and Barron counties. The apartments must include utilities and must meet the fair market rent value for that county. We have a number of individuals and families who are reaching their limit for shelter stays, and we are desperately seeking shelter before the winter hits. So, all eyes, if everyone looks, you see little signs out in the country that say for rent, or know of someone who has properties that they're trying to rent. If they would contact the Salvation Army Grace Place in New Richmond, then those leads will be followed up on, and hopefully we'll get all of these folks housed before the snow flies.
Anyone else? Deb, you're awful quiet tonight. You got anything?
I'm tired. I've been helping with COVID follow-up, so I'm really tired. Sorry.
All right, and with that, our meeting is adjourned. Our next meeting will be November 7th at 5 p.m. right here. Thank you, everyone.